Welcome to Dementia Air, a content channel devoted solely to exploring topics related to dementia. Dementia Air is a production of Beyond Dementia Coalition, a not-for-profit 501c3 which seeks to reduce stigma and help all of us not only recognize but also accept, assist, and embrace people living with dementia as valued and beloved members of the community. See the person beyond the disease. Hello, my name is Bruce Leyton, and I am your Dementia Air podcast host. And joining us today is Laila Stamer, CDP, which is Certified Dementia Practitioner. And Laila, your journey began 27 years ago in Amsterdam, where you helped launch the world's first Dementia Day Center. And after moving to Georgia, you founded a Dementia Day Center named the Tulip Place in Milton, Georgia. And I've heard great things about it. I have not been down there yet. I know those that have been, and they say it's just a wonderful place to be. But I thought I might start this, Laila, with the reason I asked to interview you is really because of two questions I received over the span of 1.5 years. And the first question was, I was giving a presentation 1.5 years ago, and it was on the topic of dementia, but had nothing to do with something like the Tulip Place, which I consider a respite care, and we can talk about that. But the person stopped me in my tracks and asked, when are we going to have something like the guest house, which used to be a respite care and Dementia Day Center here in Gainesville? And I said, well, I'm not really familiar with the guest house. Let me do some research. And then the second question was the result of a question I asked. And I was interviewing somebody for one of these podcasts. And I asked what resources are available in Gainesville for somebody that has dementia, and especially the caregivers. And the response was, well, I can tell you what we don't have. And what we don't have is respite care. And the person I was interviewing made a distinction between respite care and senior service centers or senior living center that we've got here in Gainesville. So respite care was something that was definitely on her mind and that we didn't have. So I'm hoping to discuss that with you. And I thought the first question might be, what is the Tulip Place?
Well, Bruce, the Tulip Place is a respite service, and it is for individuals living with dementia that still live at home or with their families or their spouse or live in independent living. And the only common factor they have is that they have a dementia. So the Tulip Place is a place where people join, hang out together during the day, and have fun activities, find connection, find peers, find friends. And at the same time, the caregiver gets a day off to do whatever they need to do, whether that is having lunch with friends, doing a doctor's visit. It's their day. So it has two sides to it, and both are equally as important.
But the first question that comes to mind for me is the Tulip Place for anyone with dementia?
It is specifically for people in beginning and early and mid stages that are still socializing, starting conversations, maintaining conversations, but that need a little bit more guidance in their day, but still want to meet friends and hang out and have a good day. A lot of people just isolate a little bit more and get bored during the day. So it is definitely for people in the more early stages.
When somebody comes to you, is it generally the caregiver, first of all, that comes to you, and or is it the person with dementia that's actually approaching you in terms of becoming a member, or and I'm not sure what you call them. Is it members, clients?
Yeah, it's
Uh,
members, it's participants, it's whatever you want it to be. For a lot of people, it's either the men's club or the ladies' club. The meaning they give to it and what they feel about being there is kind of what it is. But we usually call them members or participants.
Got it. And who is it that first comes to you,
It
approaches
could be
you?
both. We have
Yeah.
the most cases would be the caregiver that heard about us and is like, oh my gosh, I would love this. I need a break. My husband or wife is just kind of walking in the house, watching a lot of TV, taking a lot of naps. And she used to be so social. And this would be a great opportunity to hang out with friends. So, and sometimes it's the person themselves that is feeling like I need to see what else is out there. And this could be something for me too. So, yeah,
Interesting.
yeah.
So, so how do you, I'm assuming there's an assessment process that you go through because maybe the Tulip Place
Yes.
isn't something for everybody. Can you tell me something about
Yes.
that?
Yeah. So in the state of Georgia, there is adult daycare programs like ours, and they are often in communities, memory cares, facilities, places like that. And they're most always more a medical model. So people that have progressed some more in the disease and need also more care with bathrooms and eating and medication. The Tulip Place is a social model. That means that we really focus on the social part, the connection part. So that means people have to be a little bit earlier in the disease to be able to do that. So the process to be in a social group, we always love for new families to just come and meet us, have a cup of coffee with us, see the group, see us. And this also gives us as staff an opportunity to meet the new person and see if they're a fit. If we both like it, we do a whole assessment and we find out the history of the person that helps us in conversations. We look at what other kind of aspects of a day we need to help, which we're more than willing and able to help with bathroom if that's an issue. So we do that whole intake and we really, really try to find out what people liked to do, what they would want to do. So that first month after they've joined us is really our month of getting to know the person, see what engages them, what makes them laugh, what kind of connections can we build. And based on that, we make an individualized engagement plan. So every day we evaluate people in our group and see where we can do better or offer activities in a different way or with more prompting. The main goal for us is to set everybody up in our group for success, for them to go home and have had a great day with a lot of laughter, activities that they like to do that are not frustrating. But if people still write, Bruce, we love for them throughout the day to have little moments of still writing. And we incorporate all of that in our plan. But our first month is all to make people feel welcome, that they have found purpose, that they have found friends, that they like coming to hang out with us.
Yeah, so it sounds, I know very often I ask the question, so how do you measure success, right? You use the word success, but it really is about well-being and quality of life, and it's not necessarily statistical, right? You spoke to the social model, so it is about
Yes.
well-being. Yeah, so I've got
It,
that right. Yeah, go ahead.
yes, absolutely. We do not have like data driven ways of measuring success. We do know that every person that starts out with one day, and before we know it, family and often the group members like, can I come more? So we're doing a good job there. Plus, daily, Bruce, we hear from the people in our group how much they're enjoying their time with us and care partners. The caregivers so often let us know what a big part of their life we are and how much it does for them knowing that they have that break and that their loved one is at the same time having a good time with us.
Yeah.
So we hear it weekly.
It's wonderful to have that feedback, I'm sure, for yourself as well, given
Yes.
your effort and what you do.
Yeah,
Uh,
absolutely. And the
yeah.
thing is also our groups are very small. It's like 12 to 14 people, so you really do get to know people well. You get to know their caregivers really well. We have such an open way of communicating with everyone. So anything that pops up or is questions or yeah, we have time. We have time to help you out and help you with resources. We have time to talk to with you about your concerns. So it's just all around a very good support network.
I'd like to segue to Gainesville because,
Mm-hmm.
yeah, it seems like it's something that's lacking up here based on the questions and responses I've gotten over that 1.5 years. But it doesn't happen overnight, right? Can you tell us
No,
something about the licensing process and what you go through?
I'm from the Netherlands. And this is an established program for almost 25 years, basically in the whole Europe and in a lot of other countries in the world. So it's on every corner. It's often funded by the government. People don't need to pay. It's a program that families know instantly to make use of from the start. So when we started here, I thought it would be an easy thing to do. Well, it is not. And I am very grateful that there are a lot of rules and regulations about adult daycare programs in Georgia. And there is not specifically dementia day programs, and there are not specifically social dementia day programs. So it definitely has been a process, Bruce, to get the whole permit and licensing done. It really takes up to half a year to a year to have all the paperwork we need. And yeah, it's hard. It's also because a social model, it's just even for the Georgia State Department of Community Health is not a clear model yet. So for us to start in Gainesville, it's not only Gainesville that misses these kind of social programs for people still living at home or independent. It's it's everywhere. We need this program so much more everywhere in Georgia.
Hmm. And that's a whole separate topic, I think, and maybe for another time in terms of you say not a clear model. And I often worry about kind of the culture of caregiving that underlies everything that we do. And if you don't have that culture of caregiving, and it's obviously different in the Netherlands and Amsterdam than it is here.
Mhm.
That's a pretty heavy hurdle to jump. And I'm just thinking through. I'm not, Lila, I'm not sure there's actually a question there. So I'm just going to probably leave it at that. So I admire you for doing what you're doing and bringing what you know and how you do it to here in Georgia. And I can tell you, based on what I've heard, and I need to visit. The Tulip Place is
Yes, you
just a wonderful
do.
place. But I do have one question, and maybe we can end on this question, and that is, you talked about it's so important to start the process of socialization and maintaining the social network earlier rather than later in terms of somebody with dementia.
Mhm.
And we find that in the presentations that I give, it's so important from a planning standpoint. It can be important from a clinical standpoint, right? If there are clinical trials available, but they're not available to persons with dementia that are in later stages. It's for
Mhm.
earlier stages of dementia. So why do you see it as important? Can you shed some light on that?
Well, it's super important in the progression of the disease. It is it's crucial almost that you do not do this alone. There is so many people that are willing to help, but every care partner always thinks, oh, it's okay. It goes with little steps, and most people get to a point that it is overwhelming, and then we need help. Starting the process earlier and getting the breaks, you get your, as a caregiver, you get your support network too. There is other people that understand what you're going through. You will hear of great doctors, great dentists. You will hear of all these tools you can use around the house, and understanding dementia better, understanding behavior better. It all makes this whole process so much easier. And it's always going to be hard, but it can also be a little bit less stressful.
Mhm.
Yeah.
Thank you for that because I think what we encounter, and I've experienced it in my own, personal life, is number one, and with respect to dementia and my mom, there's a denial.
Mm-hmm.
There's stigma attached to it.
Right.
And the stigma with my mom was what she felt was the stigma of dementia, and she was in complete denial as to what was happening. And of course, I've spoken before about how we don't know how to have those conversations, but to have somebody like yourself and the work that you're doing, and the let's not do this alone. It's so
Right.
important, so important. Let's
Yes.
not do this alone. Otherwise, it is overwhelming. And there's that, what I call that dementia cliff that you tend to go over if you
Right.
haven't really approached this in a more rational and caring way.
Right. It
Um,
also,
yeah.
one of the most important things too, Bruce, it prevents guilt, because sometimes people feel so much guilt of, oh, I wish I had known that, or I wish I would have done that differently. Being around other people that are going through it, you're going to learn, you're going to hear, it's tools you can try, and it just prevents that caregiver guilt that so many people do feel at the end.
Oh, and I can tell you firsthand, absolutely guilt, and you feel like you need to repent. And
Yes.
yeah, that's something I think we've all gone through.
Mm-hmm.
And so thank you for the work that you're doing.
Yeah, and it
Uh,
all is so heavy often. And social programs like these, they do make it lighter. It is well-being, it is laughter, it is fun, it is friendships for the care partners too. In doing stuff together, it just makes a world of difference.
Laila, thank you so much for this discussion. I'm hoping, I don't want to say looking forward to, but I'm hoping beyond hope that we have something like the Tulip Place and hopefully the Tulip Place here in Gainesville sometime soon. Thank you for being with us today.
Thank you, Bruce.
Beyond Dementia Coalition is on a quest to close the dementia preparedness gap we face. To get there, we sure could use your support as a donor or a volunteer. To get involved, please go to beyonddementiacoalition.org. All donations are tax deductible, and be sure to subscribe to our mailing list to receive our monthly newsletter in your inbox, where we'll share new podcasts, fact sheets, webinars, blogs, and other dementia-related content. This is Dementia Air. See the person beyond the disease.